Teethan, an innovative system to measure dental occlusion. Contents of the Teethan package. What's in the box? The Teethan Excellent Centre plaque with its custom support and screws. 4 EMG probes attached to the charging base with a magnetic panel for their activation. A USB receiver for connecting the probes to the laptop and the extension for the receiver. A charger cable that can be plugged into the laptop. A Teethan USB flash drive containing the Teethan software, user manual and a quick start guide. And 2 packs of 50 pre-gelled electrodes. Installing the Teethan software. Plug in a USB flash drive to your PC, select My Computer and open the installer folder. Launch the software setup. Follow the wizard. Click on Accept. Click on Install. Extract and follow the instruction by clicking Next, End, Next, Install, Finish, and you will see the installation completed successfully. Click Close and wait a few seconds to complete the installation. Then click Close again. Click on the Teethan software icon on your desktop and enter the activation code that you received via email. Make sure that you are connected to the internet in order to activate the user license and the automatic updates. Enter your code and press OK. Now you are ready to use Teethan. Activating the Teethan probes. The probes are composed of a mother electrode and a satellite electrode, which are connected by a small cable. To remove the probes from the charger, please avoid stretching the cable and disconnect them in this way. The probes have a magnet placed under the brand name Teethan. To turn on the probe, swipe it across the area called Swipe for Activation, like so. If the probe is on, a white LED will start blinking very quickly. The quick blinking means that the probe is looking for the USB receiver. The LED will begin to blink slowly once the probe is connected. If the LED turns off completely, the battery is low. To charge the probes, please reconnect them to the charger and plug it into the laptop via the USB cable. The LEDs are blue when the probes are charging and the battery level is less than 90%. The LEDs will turn off when the probes are fully charged. The battery status of the probe can be checked in the software after properly connecting the USB receiver and activating the probes. The probes turn off either by swiping them back across the magnet or by placing them all back on the charger when it is connected to the PC or to a power supply. Adding a new patient to the database. To insert the patient data, fill in the surname, name, date of birth, and gender. Once all the fields have been completed, click OK. If you would like to recall a patient previously tested, start typing in their surname. Select the patient and click OK. Placing the probes on the patient. After inserting the USB receiver and activating the probes, it is necessary to place the probes on the patient's face, on the masseters and temporalis anterior muscles. Each probe is dedicated to the acquisition of a specific muscle that is shown on the Teethan logo. To apply a probe, the pre-gelled electrodes must be attached. Please make sure that the distance between the electrodes does not exceed 2 centimeters. When removing the film, take care not to damage the gel part. The probes must be applied parallel to the muscle fibers as shown. To detect the temporalis anterior, palpate the muscle and ask the patient to clench. Identify the major axis of the zygomatic process of the frontal bone and apply the probe along the anterior margin of the muscle near the coronal suture, keeping 2 centimeters from the zygomatic process. To detect the masseter, palpate the muscle and again ask the patient to clench. Apply the probe parallel to the muscle fibers in the central portion of the muscle along the line which joins the lateral corner of the eye with the mandibular angle. Performing the occlusion test. Once a new patient has been added or an existing patient has been recalled from the database, click OK to proceed to the test. Prepare the patient by applying the probes and ensure that the patient is sitting in a relaxed position with their arms resting on their legs, a straight back, and without crossed legs. The first test is the calibration test. For the calibration test, place 2 cotton rolls between the dental arches on the 5th and 6th teeth, 2nd premolar and 1st molar. Ask the patient to perform a continuous maximal clench on the cotton rolls and click the record button only after the patient has started to clench. After 5 seconds, the recording stops automatically and the patient can then relax. The bars indicate the electrical activities of the muscles analysed. At the end of the calibration test, a preview of the data required is displayed in the left panel. It is recommended to carry out and compare at least 2 calibration tests to check the repeatability of the data before proceeding to the acquisition phase. To do this, simply click the plus button and repeat the recording procedure without moving the cotton rolls. At the end of the calibration test, if the previews are similar, select one of the tests and proceed with the acquisition of natural intercuspation. If the previews are quite different, repeat the calibration test again. The acquisition test is the real occlusion test. For this, remove the cotton rolls and ask the patient to perform a maximal clench, allowing the natural intercuspation of teeth, and start the acquisition by clicking on the record button, asking the patient to clench for 5 seconds. You can complete this test multiple times to allow for pre- and post-treatment comparisons by clicking the plus button. At the end of the test session, you will be asked to select the test or tests that you want to save. By default, they will all be selected. Only click Save when you want to close the recording session, and these files will be saved into the database. Creation and comparison of the occlusion report. After completing the occlusion test, a report is automatically generated. Click Save and it will be stored into the patient database. If you recorded more than one test, it is possible to compare the different results. Based on the time of recording, the label pre and post will be assigned to the tests. If you want to compare the results of other tests acquired, simply double-click on the test, then drag and drop it to the center of the screen. The software automatically recognizes which test has been carried out before and after. Before exporting the report, it is possible to type notes regarding the patient or the treatment. To save the report, press the printer button in the bottom right-hand corner and a PDF report will be opened which contains the patient's name, surname, gender and report date. The report displays the Teethan indexes and representations, an automatic analysis of the indexes, and the notes previously inserted. In the Settings menu, it is possible to customize the report by deciding which data you want to be included. It is also possible to insert your clinic details and logo. By clicking on the Save button, these changes will be applied as your default settings. Reading the occlusion report results. Teethan evaluates and displays 5 main values and their related normative bands. After 2 clench tests, with and without cotton rolls, lasting 5 seconds each, Teethan evaluates the proximal occlusion catheter index, otherwise known as the POC, which calculates the prevalence between each muscle couple. The barycenter, otherwise known as BAR, that is related to the anterior or posterior behaviour. The torsion, noted as TORS, for the evaluation of the torsional behaviour of the jaw on the horizontal plane. And the impact, noted as IMP, for the evaluation of the muscular work. The values can be seen as graphical representations or numerical values. In terms of representation, the temporalis anterior muscles are represented in blue and the masseters in pink. The horizontal rows in blue and pink represent the normative bands, referring to the temporalis anterior and masseters respectively. If the blue and pink symbols are in the center of the green areas, it means that everything is well balanced. A displacement of the symbols outside of the normative bands shows where the patient's muscles work more. In this particular case, we can see that the left temporalis muscle is working more than the right one, as the blue symbol is shifted towards the left side of the mouth. This means there is a prevalence of contact in the premolar area. Regarding the molar area, the pink symbol is shifted to the right side of the mouth, so the right masseter is working more than the left. This means that there is a contact prevalence in the right molar area. Both the blue and pink symbols are displaced forward compared to the horizontal normative bands, meaning that the barycenter is anterior and the patient is overloading the anterior part of the mouth. Within both symbols, there is an arrow pointing to the left side of the mouth. This means that the patient has a left torsion of the jaw. Next to the image of the mouth, there is a dial which displays the global value of neuromuscular balance, which is an average of all of the calculated values. In this case, we can see a value of 81%. If the global value is above 83%, it will display green. If between 75 and 82%, it will display yellow. And if below 75%, it will display red. A green value indicates a well-balanced patient. Now, let's focus on the numbers. The POC index monitors the difference in muscle activity between the left and right sides to identify whether there is a dominance. There are POC values relating to the temporalis and the masseters. In this specific case, the temporalis POC is 67.57%, outside of the normative range. The letter L indicates that the left temporalis muscle is working more. The POC of the masseters is 87.38%, which is within the normative range. The letter R indicates that the right masseter is working more than the left. The occlusal barycenter is calculated by comparing the activities of both temporalis versus both masseters. In this way, we can understand the prevalence on the sagittal plane. In this case, the barycenter is 82.96%, which is outside of the normative range. The letter A is for anterior, which indicates that the patient is working more in the anterior part of the mouth in the premolar area. In the case of the posterior barycenter, you will find the letter P, indicating the masseters are working more. The torsion is calculated by evaluating the activities of the crossed muscle pairs and refers to the microscopic torsional attitude of the jaw on the horizontal plane. In this case, we have a value of 81.85%, which is outside of the normal range. Also in this case, the letter L stands for left, and it means that the left masseter, right temporalis pair prevails on the opposite couple. To understand which pair works the most, we follow the guide, the temporalis leads. Therefore, in right torsion, the right temporalis, left masseter pair prevails, while in left torsion, the left temporalis, right masseter pair prevails. The final parameter is the impact, which represents the muscular work produced. This index is proportional to the bite force. It is calculated by taking into account all of the muscles, and it allows us to identify patients who are a clencher, or with a weak bite, or a nociceptive reflex. By clicking on the second button on the occlusion sidebar, you can analyze the muscles through a pie chart. This pie chart allows us to assess the muscle activity distributed in the 4 quadrants of the face. In this specific case, there is a prevalence on the left temporalis compared to the right. It is also possible to check the percentages in the table below. By clicking on the third button on the occlusion sidebar, you can analyze the ASIM index, which quantifies the symmetry between the left and right muscles. In this case, we have a value of -13.54% and the letter L. This means that the left side prevails over the right side. You can also see the activity represented in blue and pink bars, which displays the intensity of contraction of each muscle. The full bar is the muscle which is working the most, whilst the others are represented relative to this. This screen allows us to see if there is a hyperactive or a hypoactive muscle. In this case, the left temporalis is represented with a completely full bar, so for this patient, it is the strongest muscle. Performing the chewing test. After inserting the receiver and activating the probes, it is necessary to carry out a calibration test, as we did for the static occlusion test. For the calibration, it is recommended to carry out at least 2 tests to ensure repeatable data. To activate the chewing test, click on the green chewing button in the bottom left-hand corner of the screen to show a right chewing and left chewing display. We then ask the patient to chew some chewing gum until it is soft. Then, we ask them to chew only on the right side and record for 15 seconds by clicking the red record button. We then repeat this on the left side for 15 seconds. After the recordings have been completed, the report will be automatically displayed. Reading the chewing report results. Reading the report from left to right, we can see the chart related to the chewing test on the right side, the antero-posterior prevalence of the right and left side chewing in the sagittal plane, the global symmetry index, noted as SMI, and the chart relating to the chewing test on the left side. All of the graphs represent the neuromuscular coordination during the dynamic task. Optimal coordination is when the activation of the temporalis and masseter muscles of the working side are evenly distributed, as shown on the right side. In this protocol, the chewing symmetry index is calculated, which is a global index of the neuromuscular coordination. It is a single index that evaluates both sides with an ideal value of 100. The further we move away from the ideal value, the greater chewing imbalance. In addition to the graphical representation, some numerical indices are calculated for the right and left side. The frequency represents the number of chewing cycles per second. TA impact is an index of the muscular work produced by the temporalis anterior muscles during the test. MM impact is an index of the muscular work produced by the masseter muscles during the test. And impact of the working side is the non-normalized muscular work of the right and left side during the execution of the test.